completely different topic. I get asked this all over the country when I travel. Can you feed babies on high flow? Especially now that there seems to be some consensus that high flow means 5 liters, 6 liters, even 7 and 8 liters per minute on some pretty tiny babies. Do you feed them, and how? Brett, let me start with you.
Firstly, I'd say there's no large randomised trials of feeding babies on high flow versus any other mode of support. When you do look at the randomised trials that have been done, though, there doesn't seem to be any problem in terms of high flow use and nutritional or weight outcomes. In our unit, which is anecdotal, we are very comfortable with babies suck feeding either at the breast or the bottle on high flow at any flow rate. So if they're ready to have suck feeds and they're on high flow, they have suck feeds.
Great. Yeah. It's very reassuring to hear. Brad?
So, yeah, that's a great question. There are no large randomized trials. There was actually, there's a study that is presented in a poster form, I believe, at this meeting, comparing high flow to CPAP and the ability to effectively oral feed, which basically, as I recall, suggested they were probably fairly similar, but it's completely dependent upon the patient and their readiness and their ability. I think what we just need more information, and we do PO feed some of our babies who are on high flow. Most of them then tend to be the larger babies, so 34 weeks and above, who are clearly have good cues, are on it and are stable, and we've done it up as high as 6 liters. We typically our feeding specialists, our speech therapists, occupational therapists, they push me to say, why don't you wait until he gets to 3 liters or 2 liters or whatever? But I say, if he's ready to go, he's ready to go, and if he doesn't do well, then that's fine, we can pull back. But I would like to see more investigations of that, particularly using techniques that can actually assess the suck-swallow technique, as well as a randomized trial that has a specific population data set that says inclusion-exclusion criteria that really give us an idea of whether it is or is not A, effective, and B, safe.
Yeah. And hearing you say that, I should probably add the caveat that whilst I said we would feed babies on high flow, that's true. I think by the time they're getting ready to feed and we're in the 34, 35 week range, it's very rare for a baby to be on high flow at a high flow rate. They would generally be towards the lower end of our spectrum, 4, 5 or 6 litres at that time. And mainly the sicker babies are still on CPAP in our unit. So I think that's important to say that whilst I've said that you could feed a baby on high flow, the truth is most of them would be on that medium to low flow rates.
Some of the places, before I get to you, Mir, some of the places are even asking about gavage feeds on high flow. Any issue with that?
Absolutely not.
Good.
We gavage feed a baby on any mode of respiratory support.
Our emphasis is to increase enteral feeds as quickly as possible, and we don't have problems with that.
I wanted to hear this. Say it, Amir, your practice.
Two factors are playing a role. First, the acuity of the distress. If the baby is on high flow and he is still in distress, he's not getting PO feeding. Because he can't eat PO in any mode, even if he's spontaneously breathing, but the rate of breathing is 60, 80, he's not getting PO feeds. And usually with time, when the baby is ready to be fed, and he still needs high flow, it must be a baby who is like chronic, like a BPD patients. And those we are allowing them to feed PO if they have the possibility to eat, if they want to. So this is still anecdotal, because if he has a BPD and he's not in distress and he can try to feed, we allow him to do it. But it's still the bigger babies and not in the acute stage.
Great, thank you.